Joining us now is Dr. John Alogrante, Health Education Specialist, Professor at Columbia University, and Public Health Researcher. Dr. Alogrante, thank you for taking the time to be with us today. But I think your most important accomplishment might be being my doctoral advisor at Columbia? What would you say?
Very proud of you.
Thank you, thank you. Well, I'm very excited to be talking about this new initiative, this call to action that you and your colleagues have been putting together. So first, tell me what this call to action is, who is it designed for, and what does it mean?
Well, first of all, it's great to see you, Mary. Thanks very much for having me on your program. Well, what is the call to action? The call to action is really threefold. First, we're calling for an urgent and what we might describe as a warlike scientific effort to undertake the necessary studies and research that would enable us to identify the gaps in what the public understands to optimally target the behaviors of interest in this pandemic. So for example, we really do still need accurate data about the preventive behaviors of individuals. We need to know what their perceptions of susceptibility to COVID-19 is. We need to know about their attitudes toward the protective behaviors that we are recommending to mitigate community transmission. And there are lots of other gaps in our understanding of the COVID-19 prevention behaviors that we could learn much, much more about through large-scale population-based surveys. Second, we need to better utilize the available digital technology to more efficiently target the at-risk individuals and to tailor interventions to reach individuals. So for example, we talk about three existing resources that are at the hands of our state, local, and federal government. The National Emergency Broadcast System, the Amber Alert System, and even the National Weather Alert System. All of these systems, in addition to other state or nationwide emergency mass text alert systems, could be used to provide cues and to really provide the nudges that are going to be necessary to activate behavioral change in the public. So just to give you a very brief example, I get text alerts from a VA system health avatar that's called Annie. It's not particularly tailored to me because I'm not a vet, but we've been looking at how this system works, how people respond to it. And it just sends reminders to veterans around the nation to do certain things with respect to reducing their risk for COVID-19 infection. So the question is here with respect to this, are we really pursuing an optimal health communication strategy at this point now that we're over 6 months into this pandemic? Are the strategies sufficiently agile to flexibly engage individuals through real-time digital and other channels of communication? And are the strategies appropriately tailored and targeted to those most at risk of contracting and spreading the virus? And then finally, third, with respect to what this call is all about, we think this is really an opportunity to advance what we might call pandemic behavioral science for this moment, for now, but also for in the future. And at the same time, improve the public health response. And what this means really is building on what we have learned from the pandemics of recent decades in response to, for example, the HIV AIDS epidemic of the 1980s and the outbreaks of influenza, Ebola, and severe acute respiratory syndrome, and making new investments in our public health system. You know, we've been devolving the role of government over the last 40 years. And I think what we're now seeing are the consequences of having done that, and in particular of having degraded the public health infrastructure and the public health workforce. So that's what this call to action is.
And just based on what you had said, this got me thinking about Operation Warp Speed and having the funding being distributed and rapidly trying to find a vaccine. And I was thinking about some similarities between the two. Should funding be allocated to research and quickly so that we can have a better understanding of how this can be done?
Well, the answer is yes, of course. And I think while the dominant government narrative, media narrative has and continues to focus largely on therapeutics and what it is that we know about treating COVID-19 patients, the move to develop a vaccine, and of course the issue of testing and contact tracing. While that narrative is certainly important and those remain critical elements of this fight against COVID-19, the narrative is really still missing the behavioral science expertise that is central to maximally achieving protective behaviors. And, the question is, why is that important right now? That's because the only evidence-based preventive strategy currently available to halt the pandemic is population-wide behavior change. That's the best way that we can prevent this potential tsunami of chronic complications that will be associated with COVID-19, the increased healthcare costs that will be associated with it. So, there's real urgency here. And, we shouldn't forget that we are in the midst of a national pandemic. We have been seeing substantial increases in just the last few weeks of new cases of community transmission. So the time is to act now. Wear a mask, practice good hand hygiene, and spatially distance ourselves. Those are the key behaviors that we need to continue to reinforce with the public nationally, not just locally or at the state level.
So I'm thinking back, of course, to our work together, which I've learned so much about how complicated behavior change is. First, we need to have awareness, then we need to have an understanding of what's happening, and then we need to have a perception of how it affects an individual. So can you explain the process of behavior change? I mean, we progress and then we regress, and how do we get people to actually change their behavior?
Well, it sounds like you've learned your lessons well at Columbia, and as a daughter of Columbia, I'm delighted that you have. Let me just say that. Let me begin answering that question by saying that we learned a lot from the pandemic of 1918, and we learned that doing what we're trying to ask the public to do right now is really difficult. And I think there are probably three important lessons that came out of the 1918 influenza pandemic. One is that we need to be concerned about public indifference and public complacency. Both of those together will lead to the public underestimating the risk and what's really at stake here. The second thing is that, and this goes to your point about behavior change, the mitigation strategies that we are recommending, of course, go against everything that we know about human nature. Humans are social animals. Requiring people to wear masks, to spatially distance themselves, to shelter in rigid isolation, to protect others for what could be long periods of time. This is really difficult, not only to adopt as a set of new behaviors, but to maintain over a long period of time. And then finally, the problem that we're now facing is the problem of outwardly healthy appearing pre-symptomatic or asymptomatic people who unconsciously become disease transmission vectors and infect others. Those are the behavioral challenges that we're facing. And you're right. I mean, to really help people to adopt new behavior, they first of all have to feel susceptible to the problem that we're trying to prevent. And they have to feel real threat about it. And they have to feel that it has serious consequences for them. But if they are susceptible, if they perceive themselves to be susceptible and that there is a real threat and that it's serious, if we can offer them science and evidence-based practices such as wearing the mask, practicing hand hygiene, and spatially distancing, where we are getting more and more data about the importance of these practices, we can offer something that can help change them, help them change their own behavior. But there's no doubt about this being challenging. It's a very difficult thing to do with large human populations.
And you, among other internationally recognized public health researchers, are working towards this. We have this announcement, but what are your plans moving forward, and what do you hope will come from this?
Well, I have a small COVID-19 working group, a couple of doctoral students, and one colleague at Columbia. I'm also collaborating with a colleague at the Veterans Administration at one of the New York Veterans Administration hospitals in the New York Langone Health Center. So we are interested in developing prevention approaches for the VA population, for example. They're at particular risk, and they're particularly vulnerable in terms of vulnerable populations in this country. So, you know, I intend to and plan to pursue research that will attempt to address at least the first of these elements of action, and that is to better understand what the public knows, what they need to know, and what they perceive as being important to help them adopt these behaviors and to maintain them. And let me just say this, that I think it's really important that we remember that what we are asking of Americans at this time is not unlike what we asked of Americans during the Great World War II, where there were substantial sacrifices made by Americans in the effort to achieve a goal, and that was to win the war and win it decisively. We have to do the same thing here. We have to think about this as a war. And I'm always reminded of the challenges we face in asking people to do things that in some ways do interfere with their personal preferences and maybe even their personal freedom. It's the enduring dilemma of our democracy, this idea of how we balance private right with public good. And I'm reminded repeatedly over the years of my own work about how this dilemma plays out in protecting public health. So for example, we have come to political consensus regarding automobile restraint systems. We've come to political consensus about prohibiting smoking in public spaces. I think we should and can come to political consensus about the need to wear a mask at this time, because we know it will help you to protect others from infection. So these are really big issues right now that form the context for what we're doing. But this is not unlike other public health challenges that we have faced. And we do have preventive actions and practices that can help to mitigate the spread of this virus.
So I wanted to circle back to a very powerful quote that you had said in the news release. So, Dr. John Algrante, fighting this pandemic will require new weapons and a new resolve on the part of the government and the public. A national historic commitment is needed in which behavior change methodology is a dominant weapon in the nation's public health arsenal. So you have the floor. Final thoughts. What does our nation need to know?
Well, the most immediate thing I think people need to know is that we are seeing substantial hotspots across more than half of the states at the moment, and I think we are going to have to step up our recommendations for wearing masks while in public, staying home where possible. That's not always possible. We have many people on the front lines and first responders who can't do that. I think we need to respect their contributions to our society and our own lives by understanding to protect them. We need to do things like stay at home where possible, wear the mask, and to practice the hand hygiene. That is clearly the advice that I think is most urgent right now, in light of the fact that we see the kinds of increases in states like Texas and Florida and other parts of the Southwest and the far West, if we're going to, stop this virus, and we have to.
Dr. John Elagrante, thank you for taking the time to join us today. We will be sure to follow this work, and congratulations on all of the work you've done so far.
Thank you, Mary. Pleasure to be with you.
Oh, take care.